Ladies and gentlemen, good morning. If you would please take whatever seats are remaining. If any of you would like to fill in, we don't have very many seats left, but thank all of you for being here this morning. I'm Jay Darden, the Commissioner of Administration. It's my pleasure to welcome you this morning to a day that has been coming for literally more than a year. An agreement was signed a little bit more than a year ago, a letter of intent that led to the announcement that is being made today for Ochsner to join LSU in operation of the hospitals here in Shreveport and in Monroe. It is a day long in coming, but it is a day that signals a new future for the delivery of health care in North Louisiana and medical education here at this great institution. I'd like to recognize several groups of folks who are with us this morning first. There are a number of members of the Louisiana Legislature who are here. If you would please stand and let us recognize all of you who are here. I believe there are members of the Board of Regents as well, if any of the members of the Board of Regents are here. I know there are members of the LSU Board of Supervisors. If you please would stand and let us recognize you. And there are members of the Ochsner Board as well, I know.
Yep.
It's certainly no secret why we've gathered this morning in the merger, if you will, of these great institutions that are going to be delivering health care to the folks in North Louisiana. This has all been made possible as a result of the commitment and work of Louisiana's Governor, John Bel Edwards. And it's my pleasure to introduce to you this very hardworking gentleman who's taken a particular interest in the future of health care and the future of medical education in North Louisiana. Governor.
Thank you. Thank you. Good morning and thank you. Thank you, Jay, for your introduction and for all of your hard work as Commissioner. And thanks to everyone who is here. And I can tell by the buzz in this room that there's a lot of excitement, and there should be. Today is a great day. And it's not just great for Shreveport, but it is really good for Shreveport. And it's not just great for North Louisiana. This is a great day for the entire state. And it's a day that's worthy of celebration. I made a promise to this community and to the people of Louisiana that the Shreveport Medical School, that the LSU Medical School in Shreveport would stay right here in Shreveport. I also made a promise that the hospital would be stabilized and over time strengthened so that together they will continue to play their vital roles, except do so in a much stronger way for the people of the state of Louisiana. And today, after many, many months of hard work, I am proud to deliver on those commitments. Thanks to a new partnership. Thanks to a new partnership between LSU Health and Ochsner. And I want to thank everybody who played a role in this, because this was not an easy task. And I want to certainly include in my thanks and appreciation the Commissioner, Jay Darden, my Executive Counsel, Matthew Block, but King Alexander and all the folks at LSU, Warner Thomas and all the folks at Ochsner, the Biomedical Research Foundation, Steve Scrivanos and others, and all the folks at the boards of these various institutions as well. Everyone worked to see this partnership to fruition, and they understood what it means to the people of our state, to North Louisiana in particular. As you all know, the school and the hospital provide critical services to the citizens of Shreveport and North Louisiana. And the mission is special because the hospital here provides services to everybody who comes, regardless of their ability to pay, regardless of their station in life, and they treat people from all over Louisiana and outside of Louisiana. And you also know that the medical school and the hospital also provide a tremendous financial impact to this region, direct and indirect, and the number of jobs that are created as a result of the activities of these institutions. And this model that we have now between Ochsner and LSU Health, it is a true partnership. This is a 50-50 partnership. So we're not going to have two silos that operate independently of one another with no transparency, with no cross-fertilization. Those days are behind us. This is a true 50-50 partnership where LSU Health, Shreveport, and Ochsner are going to form a new health system to oversee and coordinate activities between the Health Sciences Center and the healthcare delivery system. And under this structure, Ochsner will bring their nationally recognized expertise to the management of operations for partner hospitals in Shreveport and Monroe, and the clinical activity of the LSU Health Sciences Center Shreveport Faculty Practice Group. LSU will continue to successfully oversee the School of Medicine, the School of Allied Health Professions, School of Graduate Medical Studies, and the Graduate Medical Education. The health system and all facilities will be co-branded Ochsner LSU Health System of North Louisiana. That is a name that demonstrates this joint commitment to working together and improve outcomes for patients while training the nation's finest healthcare professionals right here and all across Louisiana. Doctors who are then going to go into practice all across Louisiana. And I'm excited for those students, and I'm excited for the patients who for many, many years are going to benefit from what we're doing here today. And I want to, again, thank all of you for being here. This truly is a great day. It is worthy of celebration. It is worthy of your excitement. And like everything in Louisiana, I am so optimistic about our future. I know we're in a much better place today than we were a couple of years ago in just in so many areas, but this is one of them. This is one of them. So thank you all. Continue to join your prayers to mine for our state and for this partnership being everything that we know that it can be and should be, and that I firmly believe that it will be, thanks to the people in this room and especially up on this table. So God bless you, and thank you very much.
Thank you, Governor, for your leadership and for your vision. The lady and gentleman you see seated before you each had pivotal roles in making certain that the day happened, and it's my pleasure to introduce each one of them to you. We'll begin with the Secretary of the Department of Health, Dr. Rebecca Gee.
Good morning, and it's a very historic day today and an exciting one. As an LSU physician, former LSU faculty, and as the mother of children who get their care at Ochsner, I can tell you that this is going to be a wonderful partnership. This community has been, and I wanted to recognize the governor's commitment to making this succeed. As from day one, the future of this medical school has been at the top of his list of priorities, and something that the Department of Health has worked diligently on a solution for, and I do believe we have the right partnership going forward, and this will create better quality, better future, a stronger component of physicians in the community, and also greater access to healthcare services so that people in this community will not have to go anywhere for specialty care. The future of this part of our state, a part of our state that has some of the biggest challenges in healthcare, whether it's infectious diseases, poor maternal health outcomes, issues. Warner and I were speaking this morning about some of the really dynamic and interesting things that Ochsner is doing to look at fetal monitoring that save lives and reduce NICU utilization. All of those things will be brought to this community through this partnership with Ochsner. So I'm incredibly optimistic about your future. Really delighted and pleased to be here today, and really thank LSU and Ochsner, and am very excited for the future of this community and healthcare. Thanks.
Thank you, Dr. Gee. And next I would recognize the president of the LSU system, F. King Alexander.
Thank you, Commissioner Darden. Today is a great day for LSU, but especially for LSU at Health in Shreveport. Our physicians, and I thank our physicians, our faculty, our residents, and our students as we begin this new partnership with the most optimistic of hopes. The culmination of the work that has gone into the development of this partnership will allow LSU Health Shreveport to focus more intensely on our teaching and research mission while also ensuring greater quality care and health care for those in need with all the services that we provide here. We're thankful to Ochsner for stepping to the plate with us to address the health care needs of this region, but also to talk about expansion and serving more and producing more healthcare professionals. We're not going anywhere. I want to just put that, the medical school is not leaving Shreveport. All right? So put that thought to bed, because that's not going to happen. We want to grow and expand this medical health care and our medical education opportunities for everybody in the northeast and northwest region of this state. We're here today witnessing a turning point for this region. LSU is committed to working together on solutions to grow this program and to serve more students and provide more medical professionals that will stay right in this area. I'd like to thank our faculty who have never wavered in their efforts, and our residents and our students who've never wavered in their support of the people of this region. I'd like to thank the governor for working so tirelessly to find a long-term solution that we need for the health care of northwest and northeast Louisiana. And I'd like to thank all the individuals who have worked with us in the last 5 years. We're extremely proud to be a part of such a progressive and exciting announcement in the name of health care and in the name of medical education for northern Louisiana. We got a lot of problems. We're ranked 49th in about everything in health care. And it starts right here in this medical school, and it starts right here tackling these issues that will serve this state better. So I'd like to thank Ochsner for being a partner in this, thank the governor for taking this issue on, and we look forward to building, expanding what we do right here in Shreveport in medical education. Thank you.
Thank you, President Alexander. Next, join me in welcoming Steve Scrivanos from BRF and UH.
First, I'd like to echo all the optimism that everyone has reflected here today. Life is funny. It was 2013 when Governor Jindal sent out 3,000 pink slips to the employees in Shreveport and Monroe. And I was the chairman of BRF at the time, and we stepped up to protect those jobs to get in the hospital business. And let me assure you, I'm the happiest guy in the room today talking about this partnership. None of this has been easy. For the 5 years that we operated this hospital, we're the ones who initiated the conversation with Ochsner, and we've been trying to get it here. My only complaint is it's taken us so long to make this whole thing happen, but I'm delighted that we're here today. Just one quick thing. The hospitals that we took over from the state in 2013 had their share of challenges. They were underfunded. They had all sorts of maintenance issues, $150 million worth of deferred maintenance. I'm delighted to report to you today that through the joint efforts of the very talented people that work for University Health and the very talented healthcare physicians and residents at LSU, that we have turned these hospitals around. They are in much better shape than they were when he took them over, and I'm delighted to report to you that since 2013, we have increased the revenue from our commercially insured patients by $100 million a year. And let me tell you, without that $100 million of additional revenue, we would never survive, and the new partnership would be immediately insolvent. My thanks go out again to the University Health and LSU and our boards who made that whole thing happen. God bless this partnership. My final comment is I've lived in Shreveport my entire life. I've had the luxury of traveling to Birmingham and Austin, Baltimore, and in those cities, the academic medical centers not only do a great job of educating their students, which we do here, unquestionably, but they play a vital role in the economies of those cities. And it has been my long-term hope and prayer, and as someone who's been advancing this partnership for a long time, that the new partnership can do for Shreveport what those medical centers have done in other places. So God bless all of you. I'm delighted this day is here, and believe me, we will support it in every way that we can. Thank you.
Steve, thank you and BRF for your work and for your continued support of this new partnership. Next, the gentleman who will help run this new partnership, the Chancellor of LSU Health Shreveport, Dr. Ghali.
Thank you, Commissioner Darden. Thank you, Commissioner Darden. Thank you, Governor Edwards, President Alexander, the leadership teams of the Ochsner Health System and LSU Health Shreveport, and many others for your demonstrated commitment to the creation of this partnership. As Chancellor, I can assure everyone that this joint venture will not only meet, but will exceed the health care needs of our patients while growing and optimizing the training opportunities for our students, for our residents, and for our fellows. I'd like to give a special thanks to Secretary Gee. Rebecca has been an advocate for articulating the importance of providing the highest possible quality of care for the patients in North Louisiana. This is important, and this has been vital to us. Today has been many months in the making, but worth every hour that has been spent ensuring a brighter future for our LSU Health Sciences Center in this community. We have a long history of service, starting here in 1876 with the establishment of the Shreveport Charity Hospital, and then in 1941 with the opening of the Northeast Louisiana Charity Hospital in Monroe. This was all followed by the development of our academic and research programs that ultimately transformed these two charity hospitals into one of only 140 academic health centers in our great nation. Now we begin a new chapter, the dynamic partnership of two great institutions, LSU Health and Ochsner. I am confident we are now positioned to strengthen the quality and scope of health care and to grow medical and graduate medical education and training in North Louisiana. As everyone knows, there's a current shortage of physicians nationwide, and particularly in Louisiana. We are committed to further expansion of our class size in the School of Medicine and anticipate growth in our graduate medical education residency training programs and allied health professions as well. Additionally, our new partnership with the Ochsner Health System affords tremendous opportunity to create multi-location clinical research trials aimed at increasing access to cutting-edge treatments in both urban and rural sites, while concurrently bolstering our competitiveness for research grants. On October 1st, right around the corner, as this partnership commences, both organizations are committed to providing excellence in medical education, research, and clinical care to North Louisiana and indeed the entire region, Governor. As Chancellor of the LSU Health Science Center in Shreveport and Monroe, I am grateful and honored to be part of this significant development in the future of healthcare and medical education in North Louisiana. Thank you very much.
Thank you, Dr. Ghali. We appreciate your words and your commitment to this great institution. Finally, Warner Thomas, the President and CEO of the Ochsner Health System. Warner, thanks for all your hard work in making today happen, and we look forward to your remarks and your preview of what we can expect out of this great partnership.
Well, thanks, Commissioner. So, as you've heard, today is an exciting day. We're very excited to be involved with this opportunity, and exciting for the state and also exciting for the citizens of northern Louisiana. I know that there's been a lot of thank yous going around, but I think there's a few more I'd like to put out there for everyone to think about. I would like to thank Governor Edwards and Commissioner Darden and also Secretary Gee and Matthew Block for the great work that they've done on behalf of the state, and for, let's give them a big round of applause. I think it was about a year ago. I remember it was a Friday afternoon, about 2:30. I got a call from the governor. You can always tell it says no caller ID. So that answered and said, "Hey, would you be interested, or would you help us kind of get involved in Shreveport?" And I got to thank you for the opportunity. and also for the confidence that you have in our organization. We will not let you down. We'll work tirelessly to make sure that this is successful. So thanks for the opportunity from the state. I'd also like to thank President Alexander and Dr. Ghali on behalf of LSU and the Board of Supervisor members that are here. We are excited about this opportunity, appreciate your support, and together we'll train more physicians and keep more physicians here in Louisiana. So thank you for your amazing support and your willingness to partner with Ochsner and to put your confidence in us. So thank you very much. I also want to thank Steve and BRF for that phone call a few years ago, about 3 years ago, to get involved, and really the timing wasn't right, and things happen for a reason. But I want to thank you for your commitment to work with Ochsner and willingness to transition the facilities to Ochsner to allow us to come in and partner with LSU to have this opportunity. We really appreciate that and appreciate the support of BRF. And then finally, I'd like to thank our own board. I have several board members here. Andy Wisdom, who's our chair, Jeff Parker and Jimmy Moran, and also Dr. Butch Adolph. Our board thought long and hard about this. This is a big commitment on behalf of Ochsner. And I can tell you, our board has never shied away from a challenge. Our board always stands up and takes the challenges head on, and their amazing support has been extremely helpful. I just want to thank our board. Thank you so much. And finally, I want to give a shout out to one of the best in the business, quite frankly, Peta November, who's our Chief Administrative Officer. He was the architect from Ochsner that put this together, worked tirelessly on this with the state and with LSU and with BRF. And I can absolutely say 100% with zero doubt, if Peta November had not been in the middle of this, this would never have happened. So Pete, thank you so much. So now we're ready to get to work. The funny thing is, we always talk about there's so much hard work goes to putting an arrangement together, but now the real work starts. And we're excited to roll up our sleeves, get in here in this partnership with LSU 50-50, and to take on the healthcare needs of northern Louisiana. First, we've done a complete assessment of facilities and all of the equipment, and there's some work to do there. And we are going to jump in right off the bat and make investments in new technology, make investments in infrastructure to make sure we provide the amazing facility that the great faculty and residents of this region deserve. Some of our first priorities will be upgrading and renovating select operating rooms, surgical intensive care unit, and really making sure that we have national caliber facilities to go with the national reputation of the LSU Health Shreveport physicians, because I know it's been a challenge. But once again, as Steve indicated, they inherited some challenging facilities. They have taken it to another step and done a great job there. We will now inherit that and continue to build on that great success over the past couple of years. We'll be upgrading various equipment, monitoring equipment, lab equipment, imaging equipment to make sure that things that are outdated are really brought up to the right technology for today, to make sure the staff and the physicians here can have the right technology and also provide that care and capability to the patients in this area. We're going to increase the functionality of the medical record. Over time, we will transition to Ochsner's electronic medical record and be able to tie all facilities and all of our capabilities together throughout the system. That'll be later on next year. But I think what you'll see with this is enhancements in areas like digital medicine, where we can monitor patients at home electronically. Telemedicine, where we can monitor patients in a much broader geographic area. So you'll see us make those investments over the next year. We also plan to invest in people and programs to continue to build on the quality and the outcome that's here, and make sure that we continue to bring the programs and expand programs that have done such a great job here. But at the same time, there's a tremendous need for new capabilities, new faculty, new programs, and we're going to partner with LSU to do those things. And as King said, we're going to grow from an academic perspective, but grow from a clinical perspective. We are committed to build new joint programs together with LSU here in Shreveport and in Monroe and really around the region to make sure people can stay home to receive their care. We believe that local care is the best care. And we also have a huge commitment to make sure people don't have to leave Louisiana for their medical care. We want to keep people right here in our state and not have to have anybody leave Shreveport, northern Louisiana, or Louisiana overall to receive medical care elsewhere. So we are very committed to work with LSU on a robust faculty development plan and to make sure that we continue to recruit new faculty and build on the amazing capabilities that are at the school today. We want to try to broaden the primary care network, continue to invest in various specialty areas, and work on expanding preventive screening so that we can avoid, catch, and treat disease at earlier stages. I mean, going back to Rebecca's comment, that's the challenge, making sure we can move from being reactive to proactive. And I think that's the challenge for healthcare today in our whole country, not just Shreveport, in the whole country. We have to move healthcare to being proactive and not reactive, and we're very focused on that. I'd also like to say we're here to work with community physicians. We want to make sure we build relationships in the communities that we work in. And I think there's opportunities to build more relationships and more capabilities with the community physicians in the area, and we look forward to that. And then finally, to the staff here, we really look forward to working with you. We want to make sure not only are we a great healthcare institution, but a great employer, and make sure we work hard each and every day to have a great place for you to practice and work. At the end of the day, we're here to save and change lives. And we look forward to partnering with LSU to do that, and we look forward to shaping the future of healthcare in Louisiana. So thank you very much, and we're excited about the partnership.
Warren, thank you, and I know several members of your team are here. I know Chuck Dable, the Chief Executive Officer I saw, and Dr. David Lewis, Dr. Chuck Fox, I think are all here. Thank you for your role in the future of this great institution. I think all of you can sense today the unbridled optimism that exists here in North Louisiana about this new partnership and is really indicative of the feeling we have about Louisiana in general. Today is really a transformational day for health care, for medical education in North Louisiana. Quality is going to be first and foremost, and patient care and medical education will never be exceeded. I want to thank all of you in the audience. There have been a lot of thank yous passed around, but all of you in the audience who are going to be the ones who will help shape the destiny and the success of this great institution. Years from now, you will be able to tell your grandchildren that you were here on the day that we announced that the only O in LSU is not just our football coach. Thanks to all of you for being here, and thanks to all of you for making this happen.